Hello, welcome to Evidence-Based Public Health Workshop 1, Conducting a Community Assessment. Welcome, my name is Yanitza Soto, Community Health Worker Program Manager in the Office of Chronic Disease at the Arizona Department of Health Services, and I'll be sharing the presentation with you all today. The outline of today's presentation includes the timeline of evidence-based public health practice in Arizona, modules included in the evidence-based public health training, group rules, the evidence-based public health framework, and our community assessment module. This image is indicating the timeline in which evidence-based public health training made its way to Arizona. Back in March 2018, ADHS was invited to attend training on behalf of the National Association of Chronic Disease Directors and the Prevention Research Center back in St. Louis, Missouri. In October 2018, county health departments were surveyed and provided input on the idea of upcoming webinar series in order to cover different modules of evidence-based public health. July 2019, we began our webinar series. This is being presented to both state health department and county health department staff in order to share more information about the 3 top choices that were selected by county health departments. We hope this is helpful as we enter our Year 5 implementation for the EBPH IGA, establishing and selecting goals and activities, and also encouraging county health departments to integrate more evidence-based public health and utilize evidence-based decision-making practices within the IGA work in Year 5 and onward. This is the outline of the evidence-based public health curriculum modules. Conducting a community assessment, quantifying the issue, developing a statement of the issue, searching and summarizing scientific literature, developing and prioritizing options, developing an action plan, economic evaluation, evaluating the program or policy, and communicating and disseminating evidence to policymakers. You'll notice the 3 modules with the calendar icon indicate the 3 modules that were selected by county health departments, and we will be presenting on the webinar series. So for today, we're talking about conducting a community assessment, and the next 2 will be developing an action plan and evaluating the program or policy. Here's information about the webinar series. So Tuesday, July 16th, Tuesday, July 23rd, and Tuesday, July 30th will be when we will be meeting to share these presentations with you all. Group rules include placing speakers and phones on mute, asking questions in the chat box and to share relevant experience, and also participate in the entire webinar series if you are available. Please save the dates. So answering the question, what is evidence-based public health? Evidence-based public health is a process of integrating science-based interventions with community preferences to improve the health of populations. You see the equation below includes science-based interventions that have proven to work and to make a difference, and you add that with community preferences in the counties and communities that you represent, and that then equals to population health improvement overall. Here we see the evidence-based public health framework, in which all of the modules included in the evidence-based public health curriculum are indicated here. And this is a great framework to show how all of the different areas work well together in order to provide then the overall outcome of public health practices that have been that have gone through evidence-based vetting. So before we get more into evidence-based public health, we must first learn about evidence-based decision-making and what this actually is. So 1, we ask a question. 2, find information and evidence. 3, we critically appraise information and evidence. 4, we integrate appraised evidence for preferences. And 5, we evaluate. And believe it or not, we as individuals in our own personal lives and also in our work lives, we use evidence-based decision-making on a daily basis more than we may believe we do. An example that I'll share here and how evidence-based decision-making could be used, and a very, very simple example would be the example of what I will decide to wear to work in the morning. That is a question I'm asking myself. Which color sweater should I decide to wear? Number 2, finding the information and evidence. So the information that I have is that every time I've worn my green sweater to work, I've had a really, really great day. Number three, if we critically appraise the information and evidence. So I'm critically appraising the evidence to determine that the last 3 times that I've worn my green sweater to work, I know I've had very, very excellent days. And that is the evidence I am going off of to make my decision. Four, we integrate appraised evidence for preferences. So I also know that I will be in meetings all day, and this sweater will also keep me warm. So I will have a great day, and my preference is that I will be warm as well. And five, we evaluate. So five, I wear my green sweater that day. I see how it goes. I see if I had a great day, and if I, in fact, kept me warm throughout my long day of meetings. The domains of influence for evidence-based decision-making also include, up top, we see the best research evidence, the best available research evidence. So in my very simple example of my green sweater, at that time of my decision, and my question was, which color sweater should I wear? My best available research at that time was the 3 days prior that I had worn it. On the bottom right, we see resources, including practitioner expertise. So those resources included at that point, in this very simple example, my practitioner expertise, which is myself. My expertise is that I know that I've had great days, right, with the sweater, and that it keeps me warm. And then down to the left, population characteristics, needs, values, and preferences include then the need and preference of that I have for myself at that time, because I am an individual. But if I was talking about a group or a community or a county, for example, I would include their characteristics, needs, values, and preferences here. Here in this image is also showing us the domains of evidence-based decision-making, but now we see the difference is the blue bubble around, which includes the environmental and organizational context, which would make a difference also in the decisions that we are making. Also, there is a spectrum when we define evidence. We see lower down on the blue arrow for subjective evidence, we see that is personal experience. So my very simple example of selecting my green sweater to wear was solely based off of personal experience, very, very low on the evidence spectrum. That's much more subjective evidence because it is only based off of my experience and my personal preference there. And as we get further up the blue arrow towards objective evidence, we see that there's areas such as program policy evaluations, public health surveillance data, scientific literature in one or more journal articles, scientific literature in narrative reviews, and scientific literature in systematic reviews. So whenever we talk about selecting an evidence-based public health practice, we want to get the highest that we can on the blue area for defining evidence, especially in public health. Once again, here is the model of the evidence-based public health framework, which we will become very familiar with throughout the webinar series. Did you know? Throughout the webinar series, we will include Did You Know slides in order to learn fun facts also while we are continuing to learn more about evidence-based public health. So did you know the unicorn is a national animal of Scotland? Well, Scotland proudly boasts the Loch Ness Monster, one of the world's most famous fabled creatures. The country opted to make another mythical beast its national animal, the unicorn. Although this might seem like an odd choice, unicorns played an integral role in the country's history. On a more serious note now, we'll get into our conducting a community assessment module. So evidence-based processes in public health include conducting assessments to identify issues within a community, prioritizing these issues, developing interventions to address these issues based on review of what has worked effectively in other places, and evaluating the process, impact, and outcomes of the intervention efforts. These steps require non-health department partners across a wide variety of sectors of the community. In conducting assessments, it is important to attend not only to the needs in the community and problems, but also the community strengths and assets. Our learning objectives include understanding the importance of conducting a community assessment, including the role of coalitions and partnerships, understanding the types of data that are appropriate for assessing the needs and assets of the population and community of interest, and understand the major steps in the community assessment process. What and who is community is an important question to begin with. A common definition of community is a group of people with diverse characteristics who are linked by social ties, share common perspectives, and engage in joint action in geographical locations or settings. This may be a specified geographic region, for example, or who as individuals who have experienced or share a particular social or cultural sense of identity. For example, a community might involve members of a particular church, residents of a neighborhood, or individuals connected through social media who share a common bond. When conducting assessments, it is important to identify any subgroups that might be represented, such as youth, lower income adults, etc. This is important so that the assessment can adequately reflect the range of community members. Now, what is a community assessment? A community assessment is a systematic way of identifying needs and resources by gathering statistical data, soliciting perspectives of community members, collecting information about community resources, both a product, which includes baseline data that can be used to track changes, and a process in which community members and partners get invested in planning change. Examples of assessments may include health, needs, and capacity assessments. And for example, an assessment focusing on youth would include different elements than an assessment focusing on elderly people. What is a community assessment? An important quote to consider would be, "A balance of studies and stories." Why do a community assessment? We complete community assessments in order to gain insight into the community context, assess readiness of community, ensure intervention fit with community, focus resources and interventions, ensure common understanding of the issues, educate others, and build support and resources, as well as provide baseline for tracking and evaluation. Community assessments are essential to ensure that the right interventions are implemented. This is in part because they can provide insight into the community context so that interventions and activities are designed, planned, and carried out in ways that are acceptable and maximize the benefit to the community. In some cases, the assessment can identify, and in some cases build, support for a particular intervention approach. This support is critical for garnering resources and ensuring a successful intervention. How does it inform us? A community assessment tells us the main health concerns in the community, main reasons for these health concerns. It tells us the strengths and assets in the community, and where, how, and with whom to intervene to create change. The uncreative mind can spot wrong answers. It takes a creative mind to spot wrong questions. Social ecological frameworks. The social ecological model recognizes the complex interplay that exists between individuals and factors in their environment. Ecological frameworks also suggest that individual, social, and contextual factors influence health. There are several variations of an ecological framework that have been proposed. We will be referring to the framework created by McLeroy and Dahlgren. The social ecological framework includes individual, interpersonal, organizational, and environmental levels. At the individual level, this includes knowledge, beliefs, attitudes, skills, and personal traits. And an example includes health benefits such as coaching and counseling, medical nutrition, and therapy. At the interpersonal level, this includes more social relationships such as family, friends, peers, social networks. Examples include programs as education, physical activity clubs. At the organizational level, this may include governmental policies such as living and working conditions, institutions and policies, regulations at the local and state level. And examples may include policies such as tobacco-free work sites, nutrition guidelines for catering and vending. And finally, at the environmental level, this may include infrastructure and resources, built environment features, and safety and access. Examples include that it supports such as access to healthy foods, walking trails, and bike racks. In this image, we are looking at this image to assess the factors we see in order to identify the 4 levels of social ecological framework: the individual level, the interpersonal level, organizational level, and environmental level. At the individual level, we focus on knowledge, beliefs, attitudes, and skills. So an example when we refer to this image may be the individual knowledge of perhaps the adults that are caring for the child with their knowledge, beliefs, and attitudes towards the activity of eating chips and drinking soda while watching TV. Interpersonal level includes family, friends, peers, social networks, and relationships. For example, in this image, perhaps there hasn't been any educational programs in his community so that his family could know more about healthier choices or any, for example, any activities for children his age. At the organizational level, which considers living and working conditions, institutions, and policies, examples that could impact this image could be, for example, perhaps taxes on unhealthy foods such as sugary beverages or unhealthy snacks. And at the environmental level, which include infrastructure and resources, built environment features, safety, and access. Something that could improve this image could be perhaps the safety of the outside environment of the neighborhood in which this child is living, and also access to then healthier food options. So what questions do you ask? What is important to the community? How is quality of life perceived in the community? What assets are available to improve community health? What are the components, activities, competencies, and capacities of the local public health system and its partners? What is the health status of the community? What is occurring or might occur that affects the health of the community or the local public health system? And what policies and environmental characteristics support or hinder the goal of improving health? We may also ask who is involved in the process. As stated by Ross Bronson, we know that public health is a team sport. In this process, we should have diverse teams, work groups, coalitions, partnerships, and members of the community. Characteristics of effective coalitions include value-added collaboration. Members see benefits of collaboration. Group contribution is better than individual contribution. There's dedicated staff, so staff needed for coordination. It enhances progress and communication, as well as diversified funding. So this is not dependent on one source of funding, and members help to obtain diverse resources. Also, effective communication is important. This must be consistent and purposeful. There should be relevant mechanisms and functions to update members inciting action. Also, clear roles and accountability. Everyone must understand the mission and goals and understand what is expected and what to expect as a member of the coalition. Also, flexible structure, so it is adaptable to changes and able to assess and change the structure. And finally, priority work plans. So priority setting, creating of work plans and tracking progress, and members understand how their role and work fits into the plans. 8 deadly sins of coalitions include debate to death, social orientation, avoidance of conflict, lack of technical expertise, turning work over to staff, no ongoing role for members, dividing up credit, and not having the right people at the table. Time for another did you know fact. Did you know E is the most common letter and appears in 11% of all English words? Chances are you'll see a lot of the letter E. That's because the commonly used vowel appears in around 11% of all words in the English language. The next most common letter is A, which appears in around 8.5% of all words. Moving along to the next learning objective, understand the types of data that are appropriate for assessing the needs and assets of a population community of interest. Activity. What type of data do you need? What type of data would you need if you were tasked with improving healthful eating in low-income rural communities? In order to answer this question, we would go through step 1, reviewing existing or secondary data, which may include morbidity and mortality data, risk factor behavior data, epidemiological studies and scientific literature, public or institutional records, which may include hospital records, housing records, policies, and their enforcement, as well as social indicators, such as particularly important as and also social indicators, which are particularly important as we move toward environmental and policy changes. Secondary data resources include county health rankings and roadmaps. This is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Initiative. This includes county and state health outcomes and health factors. Another resource includes state health facts. And here's a screenshot from county health rankings, including an oversight of the Arizona state and the county demographics. More secondary data resources include American Fact Finder, Community Commons, and healthdata.gov. Step 2 includes collecting new, also known as primary data. This may be either qualitative or quantitative. Examples of quantitative methods include surveys, such as phone, online, or in person, or individual counts. Examples of qualitative methods include observations. This could be general field notes, community audits, videos, photographs, document review and policy analyses, and or interviews and listening at focus groups, community forums, listening sessions, and interviews. Qualitative data should include and occur in natural settings and produces text-based data or words, grounded in participant perspective, describes the complexity, breadth, and range of occurrences, can help generate hypotheses about a phenomenon, its precursors, and its consequences, and often paired with quantitative data. Activity. Please take a few moments to observe what is around you and write down what you observe. Characteristics of observations include the level of detail. Is it open or closed? Did you observe people versus surroundings, behaviors versus environment, relationships or communication, populations such as age, gender, ethnicity, class, etc., or other sensory observations like sound, smell, or touch? Things to consider: observations versus interpretations. Are we making assumptions, or is there any personal biases and tendencies? Did you tell people you were observing them? Did you participate? Was your focus of observation narrow or single? Components of the program versus the entire program? Or is there a duration of observation, short or long term? Another did you know fact: did you know koalas have fingerprints? Chimpanzees and gorillas have human-like fingerprints, and so do koalas. In fact, koala bears are very similar to human fingerprints, even to expert crime scene investigators. Last learning objective includes understand the major steps in the community assessment process. Step 1, plan and organize. Establish the team, the work group, or the coalition. Decide what to assess. What do you want to know, and what question will you be asking? Number 2, design the data collection. Determine what information is already available and what you still need. What is essential to answer your questions? Decide the best method to collect new data. Develop a work plan that identifies tasks to accomplish, roles and responsibilities in a time frame. Then gather the data. Step 4, review and analyze the data that has been gathered. Step 5, present a summary to stakeholders and community partners for feedback, clarification, and buy-in. Note, you can choose a certain format that fits the audience, such as pictures, charts, and graphs, and written or oral reports. And 6, identify next steps. Community assessment resources include community health assessment and group evaluation tool from the CDC, the community toolbox from the University of Kansas, mobilizing for action through planning and partnerships, also known as MAP, through the National Association of County and City Health Officials, and the National Network of Libraries of Medicine. Acknowledgements for today's webinar include thank you to the Arizona Department of Health Healthy People, Healthy Community Team, which include Desiree Green, Geraldine Haskin, Carmen Batista, and Holly Pointer. Thank you to Ross Brunson and the team at the St. Louis Prevention Research Center. And for you, thank you to you for participating in today's webinar. Reminder for the next IGA webinar series include developing an action plan and evaluating a program and policy. Thank you.